If the Supreme Court strikes down the president's controversial health care law tomorrow, the majority of Americans agree they want Congress and the president to start work on a new bill, a Plan B. But what is Plan B for Congress? Do they even have one? And how would anything get done with all the partisan gridlock on Capitol Hill? Let's ask Congressman Jeb Hensarling from Texas, the chairman of the House Republican Conference. Congressman, it's great to have you on the show. Thanks for coming in. I want to start with this idea of what John Boehner said this morning, the Speaker of the House, saying in front of cameras, if the individual mandate gets struck down, we're going to try to repeal all of the bill.
Well, I was right next to him when he said it, and I was cheering him on. I mean, the truth of the matter is it remains a bill that's impeding our economy. You talk to any business in America, I mean, the recent Chamber of Commerce poll of small business people, 3/4 of them tell you it's inhibiting job growth. The Congressional Budget Office, which, by the way, is run by a Democrat, says it could cost us almost 1 million jobs. You talk to any employer, those in medical devices, small businesses who don't want to go over 50, it's a nightmare, number one. And then second of all, it weighs in at almost $2 trillion, $800 billion of new taxes.
Well, absolutely.
You can't afford it.
The numbers are spectacularly high.
The Affordable Care Act is not affordable.
Is not affordable. And the questions, of course, about whether it actually improves care and lowers the cost for individuals. And the answers to both of those, possibly no. We're still waiting to see tomorrow morning. I wanted to ask you, though, if this court does strike down the individual mandate, as John Boehner said, is it possible that we've got a bigger problem than we did before because there is no funding mechanism now for this thing?
Well, you know, all the Democrats told us without it, the bill wouldn't work, and I agree with them. But in the short term, I'm not sure the president's going to admit to that. I mean, Americans we still have challenges in health care, but House Republicans are not going to repeat the mistakes of the Democrats and do some kind of bum's rush through a complicated, complex 2,900-page bill that no one understands. We'll take smart steps, common sense steps, incremental steps to make sure that health care is more affordable and portable and maintains its high quality and access.
To that point, Americans have said they want another bill. If this one does go by the wayside, they want new legislation that will work at the issues that they really care about, which is the escalating price of health care and also the quality of care. What are Republicans prepared to do to see those things come to pass? What elements of a GOP-led bill would there be?
Well, again, the first thing we're going to do is listen to the American people, which is not committing the same mistakes that the Democrats did before that. I think there are a number of common sense Republican bills that are out there. Number one, we can work on medical liability reform. There's something fundamentally
reform. Is that going to go to the pockets of the American people?
Absolutely, positively, unequivocally. Because we have defensive medicine that's getting practiced all over this nation. Ask any doctor. I bet you on average, we're somewhere in the neighborhood of 20 to 30% of the medicine which is practiced is totally defensive medicine. If you have medical liability reform, like we had in my home state of Texas, it improved our quality, it improved our access, it helped bring down the cost. That's just one common sense item we could do.
Two other issues that Americans have said are important to them, and I wonder how you feel about it. Pre-existing conditions. They want to be able to get coverage if they have pre-existing conditions, and they want their kids to be able to get on their plan if they're up to the age of 26. Those are two things they love out of Obamacare. I'm not sure how Republicans feel about those two issues. What do you say?
Well, right now, the insurance companies have by and large said, the major ones, are going to continue on with the 26-year-old coverage in our own legislation that we've had in the past. We did it at 25. Now, pre-existing conditions are important, but right now, I mean, it's a very important issue. But the federal risk pool that was set up in the president's health care plan right now affects 60,000 people out of 300 million. It's important that Americans know that one debilitating disease won't wipe out a lifetime of savings. But that doesn't mean that we need the president's government takeover of health care to address this problem. And so Republicans will pick up.
I've got one more question for you. And it's a question, something that your opposite number on the Democratic side had to say this afternoon. Congressman Javier Becerra had this to say about Obamacare and tomorrow's decision.
Probably the worst outcome we can see is a 5-4 decision, because I think that will go, unfortunately, a long way in confirming this growing belief in the gut of the American people that the Supreme Court no longer cares so much about the Constitution, it cares more about politics.
So, Congressman, essentially he was saying that he's worried that the vote will be so close that the American people will think that the justices were just voting their political agenda. What do you say to that?
Well, he's obviously reading a different Constitution than I am. It's a co-equal branch, contrary to how the president got it wrong since Marbury versus Madison. They have the opportunity to review this. We have an interstate commerce clause. We have an enumerated powers clause. And if you have a government that can essentially regulate inactivity, what's next? Are they going to fine us if we don't eat broccoli on Tuesdays?
I think that's one of the discussions.
Are they going to force us to join health clubs? I mean, the more interesting question is, besides the policy, this is about the Constitution. And
is it about government overreach? Is it about the power of the federal government and how far it should go?
I believe sincerely, as do lots of people all across America, that besides being bad policy, this is overreach. It is unconstitutional law to essentially tell an American in the privacy of their own home to tell them, get off your duff and go buy an insurance policy or we're going to fine you. It's wrong. It's unconstitutional. We can do better.
And on that note, Congressman Hensarling, thanks for coming on tonight. It was a pleasure talking to you.
Thank you
so
much.
All right, now we want to know what you think.